what we're going to show you here today is an example of the power of our SFMA, how we can get to the cause of the problem through some very simple maneuvers. Now the breakout, or the test I'm going to use, is we're going to look in the transverse plane. That's where a lot of bad things happen in transverse plane, so we're going to do a rotation test, or the multi-segmental rotation test. And the criterion we look for when we do a multi-segmental rotation is, can the individual turn their body a total of 100 degrees? Now, to break that down a little bit better, the person has to stay tall, so we don't want to see them leaning to one side or another, bending forward at the waist. They've got to stay nice and tall, and we're looking for a total amount of 100 degrees of rotation. How do we get to 100? Well, we know the spine has at least 50 degrees of rotation in it, and the hip has 50 degrees of rotation in it. So what we're looking for is the person turns, and I think the easiest way for the viewer to see this is from behind. We have the individual turn and rotate as far as they can, and if you could see this other shoulder come around, you know they're at least beyond 90 degrees or close to that 100-degree mark. In this case, you can see it's way short, and we can go the other direction with rotation, and it's even worse. So not only are they both dysfunctional, they're asymmetrical. Now, the next step in our process is we want to try to isolate the movement to the spine. Now realize what we just tested was standing. So in that case, we were looking at the trunk rotating 50 degrees. We wanted to see the hips or pelvis rotate half of that, or 50 degrees, coming from here. By having the individual sit down, we can isolate the rotation just to the trunk to see if we have a problem there. Now, one little trick or easy way to measure this, and we were looking for 50 degrees, to sort of hedge your bet so you don't have to measure, is if you have the individual sit on the chair on an angle here at a 45. Now, if you think about it, if you were looking down a chair, we have the front of the chair here, side of the chair here, but because she's sitting at a 45-degree angle, as she rotates with a bar on her back, I can see if that bar gets parallel to this edge or beyond, or if we rotate the other direction. If it gets parallel to or beyond, I know you're at least 45 or close to that 50-degree mark. In both cases, we just seen here, it's grossly restricted. So I know I have a problem, at least in this loaded posture, with the spine rotating to 50 degrees. Okay, so to recap what we are here, we've gone in the standing position or loaded position, and we saw there was a restriction in motion. Then we isolated the thoracic spine, or the spine as a whole, in the seated posture. Looking to seated, we have 50 degrees side to side. It looked like there was a limitation. So we go to the next step in the process, and we're going to go into what we call a lumbar locked position, where we have the patient rock back on their heels. And in this posture, what we're doing is we're trying to open the facet joints in the lumbar spine, take the motion away from lumbar, but keep the thoracic spine unloaded. So there is no requisite stability requirements going on here in the thoracic spine. Now in this posture, we'll have her put the arm behind her back, and we'll say, okay, rotate for us, or try to raise your arm or your shoulder as high as you can to the ceiling. We're still looking for 50 degrees, and I think you can see that's not 50 degrees. This gives every indication to me that it looks like there's a mobility restriction going on here. But one of the rules of SFMA is, after every active movement, we do a passive movement. So if I come in here and grasp hold of the shoulder and raise her up, you can see there's plenty of motion there. I go way beyond, and it's very easy for me to get to this above 50 degrees. Now, just for the viewers, we'll go to the other side just to show the same thing with rotation limitation. So we just looked at rotation one direction. Here we see it actively the other way. It's still not getting close to that 50-degree number we want. And if I come in here and raise up, you can see I go well beyond the 50 degrees easy. So now think about what we just saw happening here. We couldn't rotate loaded. We were limited. Standing in our functional posture, we couldn't do it. We isolated to the spine in a seated posture, still look limited. We went to an unloaded posture here where there's no stability requirements being called upon the spine, did the same thing, didn't work when she actively tried to do the motion, which would indicate to me that maybe there's a mobility problem going on, but when I passively came in and lifted up, plenty of motion. What does that tell me? It tells me the problem has nothing to do with mobility, because when I passively lifted her up, she had all the mobility in the world to do that. The mobility's there, she just couldn't actively bring that motion or create that motion with her musculature. in the unloaded posture, and certainly that manifests in the upright posture. So how would this be classified? This is a stability or motor control problem, or a problem of activating and sequencing the muscles or those control muscles along the thoracic spine.